We are now live. TikTok live number 25. It's my 25th one, I think. I've been doing this a little over 6 months now. Maybe between 6 and 9 months going on now. And this is number 25. We're getting there. Quarter of the way to 100. All right. Yeah, I live across the street from the hospital. So we got ambulances every 30 seconds in the background. Ron Bray joined. Ron Bray 46. Jet Galloway joined. Tori, taking my DAT this summer. Any tips? Yeah. So obviously you want to study really hard. If you can start studying for it now, that would be a good idea. I don't know what time in the summer you're taking it, but DAT, let's see. Crack the DAT is good, especially for the PAT section. You have Chad's videos, excellent for Gen Chem and Orgo. You have AP Bio. You can use an AP Bio Regents book. You have DAT Destroyed. You have DAT Bootcamp. You have, I already said Crack the DAT, or Crack the DAT, they call it. These are some of the main sources that you can use, okay? And there's so many more resources out now. Bootcamp, DAT Bootcamp has really elevated its caliber. And it was great back then, too. So, all right, Tori, let me know what you think. And if I said it too fast, just run it back, right? I'm going to put this, I'm recording it right now in Riverside. I'm going to put this up on the podcast and YouTube channel tomorrow, later, whenever I can get to it, okay? Gianna joined. What's up? Roland Proctor joined. Neptune joined. Joanne Capabianco Ma joined. Martin Devine joined. Or Devine. Jayla Salas. Hey, Doc, how was your day? Hey, Jayla, thanks for asking. The day was good. Just got back from Miami today. Was at Holly and Joe's wedding. Shout out to Holly and Joe. Congratulations. They are now married as of Saturday. So that was exciting. Great weekend. Got back a little bit earlier today. Had to take an earlier flight. And yeah, we got back. We're in it. We are in it now. Excellent. I just realized the light's not on. So let me fix this really quickly. But yeah, thanks, Jada. How was your day? How was your Monday? Bello joined. Bello asked, you are a nurse, right? I am not a nurse. User 89335. You single? For me to know, for you to find out. Jayla Salas liked the live. Thanks, Jayla. Lily Farmer joined. What's up, Lily? User 9592 joined. Tommy Joseph 69 joined. What's going on, everyone? What questions we got? I got a good got a good 10 to 20 minutes. DeColdest joined. Nick joined. What's going on, Luke? What's up, Luke? Luke said, I missed the recent lives. Yeah, man. You did miss the recent, 2? And I know I come on very sporadically. So kudos to you that you were able to hop on today. Also, Luke, excellent stuff, man. Your content's popping off recently. You got to keep that going, man. You're putting out some good stuff. So congrats to you. Yeah, that's Luke. He's a pre-dental student. Luke, I don't know your handle because it doesn't show on here. User 8933 asks, "What's your type? What's your type?" Let's see. Ambitious. I like ambitious. I like hardworking. I like dedicated individuals. People that don't label themselves by what they do, right? Walking around calling themselves an oral surgeon or this. I know it may seem like doing my content, but if you meet me in public, like, call me Brendan. Like, let's talk about other stuff, watches, exercise, and I'll talk you off about oral surgery or teeth too. But so what's my type? I don't know, someone who's willing to invest into their future, not the now, but en futuro. I like people that really think about passive income and the greatest, the most important things of life, family, family values, puts their friends before them. That's what my type is. Miguel said, so are you single? Single, LOL. I'm just noisy. Hey, just noisy. Am I single? No, I'm not single. IS asked, Dr. Gallagher is awesome and very helpful. Thank you, IS. I appreciate that. Thank you, friend. Luke said, thank you. Just started testing IG Reels a little. Yeah, man. What I would recommend is use your TikTok content as your beta testing. So maybe you put up one TikTok a day, for example. Take the best 3 of that week and pop those up on Instagram Reels and watch what happens. Frog said, did you use certain programs to study for the DAT? Yes, like Crack the DAT, DAT Booster, DAT Bootcamp, and Chad's videos. Those were 4 of the main programs that I used. User 8933 asks, Latinas? Kissy emoji. See, me gusta Latinas. I was just in viajar in Miami antes el fin de semana. Sí, en Miami. So mucho hablar en español. Aprendiendo cada día. Todos los días. Yeah. Oh man, that's funny. I was just watching a Mexican restaurant video where they take a video of them like making a tortilla or something, right? And they put a voiceover of like a Donald Trump AI voice, and it opens up with, "I love the Mexican restaurants. I love the Latinas. I love los cotitos or las cortitas," and that's really funny if you know what cortitas means. I thought that was hilarious. Miguel said, "Oh my." Zachariasen said, "I'm a dentist student from Sweden dreaming of being OMFS. How is it working as an OMFS?" So I'm still in residency, right, Zachariasen? Also, congrats. I love your last name, Zachariasen. I know how the son in the end is like um, generally passed down from Viking times where it's like Ragnarsson, right? So it's like you're the son of Ragnar. Ragnar was the first name of one of the older Vikings. I always thought that was a pretty cool thing. So, Zachariasen, I like your last name. How is it working as an oral maxillofacial surgeon? So, as a resident, it's very rigorous. It's a lot of working hours. There's not a lot of paying for it, and a lot of work to do. So, when I graduate and I get out and I'm working in private practice, hopefully, starting August 2025, because I graduate in June 2025, July 2025. I'll let you know how it is working outside of the hospital, because that's really what I'm looking forward to. It's a lot. Residency is a lot, and I'll save you other comments for another day. CV said, "Wait, didn't you let someone tour your apartment and he gave you your rent for a month? You look familiar." That's that's me. That was Juan of That Was Epic. He did. He did tour my apartment. I didn't spend that though, because I do foresee an opportunity in the future to give that away. It was given to me, and I just want to pass on the positive gesture. User 8933, Te español esta perfecto. No. Es bueno, pero yo quiero perfecto hablar en español en futuro. So, posible, sí. Pronto. Puncho says, "What's maxillofacial?" So, I mean, the way I kind of just layman's terms describe maxillofacial is like the facial region, right? Maxilla meaning maxilla. Sometimes they refer to the top jaw and bottom jaw both as, the maxillary region. And maxillofacial also encompasses the orbits. Honestly, top of the head down to the clavicle. That's kind of what oral surgery is involved with as far as the surgery goes. And so oral, right, the mouth, and then maxillofacial. Just facial is probably the best way to simplify it. Facial bones. Any facial bone fractures goes to us on Facial Trauma Day. Miguel, so other than wisdom teeth, what else do you do? We do facial trauma, all facial trauma, like facial fractures, lacerations, other trauma to the face, cancer of the head and neck. We do big surgeries like that. So you're asking, other than wisdom teeth. All right. So one of the big things that we do in addition to trauma and facial fractures and fixing them and cancer is orthognathic surgery. That's really kind of the staple differentiator of oral surgery from other specialties in dentistry and other specialties in the maxillofacial, the facial region. Orthognathic surgery is when, for example, we cut the top jaw or the bottom jaw back here and we move it forward, backwards. Maybe we adjust the cant of the maxilla, of the LeFort osteotomy. You cut it right here, going back, obviously. And then you adjust the cant. You could, forward, backwards, up, impact, we call that. There's just so many ways to do it. Number one thing, obviously, in many cases, we're doing orthognathic surgery to adjust the facial aesthetics or cosmetics based on the bony structures underneath and how the soft tissues lie on top of that. But another big reason we do it is to adjust the occlusion, such as if you have a dental facial deformity, you have maybe hemifacial microsomia or whatever it may be. And we have to get the teeth into a better arrangement between the top jaw and the bottom jaw. All right, so I tried to make that very brief using layman's terms for you. Okay, we got them coming in hot now. 8 o'clock. Questions coming in hot now. We're at about 9.5 minutes. I can't go past 20 minutes tonight, so let's get them in now, okay? T, what's the minimum CBSE score to apply, you think? Minimum, I mean, it's hard to say because it's going to be variable at every program. I mean, regardless of what you get applied, right? But you really want to try and aim to get at least a 70, 75. If you get less than that, you get at least a 60, I would still say apply, right? Teddy J. Park, what happens if you don't match into OMFS residency? Well, you could reapply the next year. You could do a GPR. GPR is general practice residency to become a general dentist. You could do a non-categorical internship where you spend 1 intern year at a residency program, and then you can reapply from there. I would really decide on what to do, whether it be, for example, the non-cat or GPR, based on what your why you didn't get in. If you need a better CBSE score, maybe you want to lean on doing the GPR because you're not going to have sufficient time to study for that exam as a non-categorical oral surgery intern resident. Make sense? If your CBSE is fine, what you think your application and why you didn't match is based off of more experience or something, then maybe you want to do the non-cat internship. Show your commitment, show your dedication, show your interest, right? Let me know what you think about that, Teddy. Zacharias, and what's your favorite operation? Well, I really do like big implant cases. All on X's, zygomatic implants, working in conjunction with a restorative dentist or a prosthodontist, maybe. I really like those operations. I really do like taking out complicated teeth, too. Difficult wisdom tooth extractions, difficult tooth extractions in general. I really like doing that, making sure patients comfortable, they come in pain, and they leave without pain. That's some things I like to do. I really don't like to make it too complicated. I really like the days to be simple, despite all the complicated surgeries we do. And remember, those big surgeries, accrue a lot of risk, a lot of responsibility. And I don't like to shy away from responsibility, but I do like to kind of mitigate risks. And if you're in healthcare or even a lifeguard, for example, mitigating risks a lot of times is involved with preventative care, preventing things from happening before they occur. So, I don't know. So, AP1125 said, do you give facials? In surgery? I don't know what a facial surgery is, but, we do a bunch of facial surgeries, if you will, or anything from facial fractures to lacerations, facial trauma, whatever you're trying to get at AP1125. Glenroy, I am getting a LeFort one with differential impaction plus BSSO. How routine is the procedure? Pretty safe? So it depends on who you're working with, and I'm sure you have a very competent surgeon or surgical team. Pretty safe in general. It is very safe. Now remember, it is a very risky, it's a very large operation, very invasive. That's why it's being done under general anesthesia in a hospital setting. That's why you're getting it done with a big team. You have the nursing team. You have maybe multiple surgeons on this. Yeah, so it is a big procedure, right? But pretty safe. In general, it's safe. More risk than other procedures, such as getting this surgery done under moderate sedation, IV sedation. It's more risky than getting those big implant procedures I mentioned. There's a lot going on. Emma, what are the top signs of TMJ? I think I developed it after wisdom tooth extractions. It's unlikely to have developed that after wisdom tooth extractions. Maybe you have a short-term complication or side effect after your jaw being open for a while, and pressure of getting your wisdom teeth removed. It's hard to say if you develop wisdom teeth, if you develop TMJ from after having your wisdom teeth extracted. Very unlikely, by the way, Emma. I would visit your oral surgeon. Oh, you said I can't open my mouth or chew without popping or my jaw hurting. How long ago was your wisdom teeth procedure? HRHEIR. Why was the OMFS team consulted for a forehead laceration and not plastics? Oh, because in your recent video, HRHER, because we were on trauma that day. We have a 3-day rotation between ENT, plastic surgery, and us, OMFS. So we were on trauma that day. User 8933, what associations are you a part of? What do you mean associations? What do you mean? Luke Predental said, are you familiar with the Stanford Dental Medicine or Surgery Fellowship? It looks like it's after GPR. Yeah, I don't know. I don't know about those things. I went to oral surgery residency because we are the specialists in most complicated extractions. Hence, you go to an oral surgeon to get your wisdom teeth removed, right? I'm not familiar with what that fellowship is. And fellowships in dentistry are a lot different from fellowships in medicine, the medical side of healthcare. So I don't know enough about that to give you more information on that. Gidvo said, my eyes burn after the eclipse. Should I pour vinegar in them like TikTok told me to? I'm not going to recommend or suggest anything regarding your eyes or with the eclipse. Emma, I got them out like 2 years ago, though. So, Emma, I would recommend a consultation with an oral surgeon that can really and thoroughly evaluate your TMJ, both clinically and radiographically. You're probably going to have to get at minimum a Panorex X-ray. That's the big one that goes like this. They might send you for an MRI or CT scan, okay? You got to get a consultation with that. I wouldn't be able to give you much answers because of the lack of information I currently have. right? Nor can I treat you through social media. So that's that. Daniela Cohen said, what if you get TMJ after taking out the wisdom teeth? Well, I would visit an oral surgeon, preferentially a TMJ specialist in that area, and get that evaluated. Again, clinically, radiographically, maybe you need to get more extensive, more imaging done. Like I said, maybe an MRI, maybe the CT scan. See what they do. They need to take a look clinically. Okay, I can't go any further through social media, through the platform here. Cookie says hello. Hey, Cookie. User 8933 says like ADA or HDA. I don't know what the HDA is. Maybe that's the Hygienist Dental Association. I don't know. The ADA, the ADA is just the overlying organization of the American dentists. It's the ADA stands for the American Dental Association. Am I a part of any of them? I'm a dentist. Yeah, I'm not sure. Like member dues, we as a resident, a lot of that's kind of taken care of. So I'm kind of in that in between phase. Daniela Cohen says, can TMJ lead to snow vision? I'm not familiar with what snow vision is. I would suggest seeing, your TMJ specialist. That I don't think so, though. Emma said, I'll make an appointment. Sometimes it's annoying, but half the time it's so painful. Yeah, if you're having that much pain, it's definitely worth it. I know it's annoying to schedule appointments, and they're probably packed. They're booked 3 months out. If you could get in there and see it, and a TMJ specialist, make sure you see someone that knows TMJ and has experience in that specifically, right? HRHEIR, are you going to get your MD at the end of residency like some programs? No, I'm not, nor do I want to. I respect the MD in every way, the knowledge, but it's not necessary for me to do oral surgery. So therefore, I don't want to get it. And I'm in the 4-year track where I'm just going out. I get my oral surgery degree, the certification, and I can do oral surgery, right? Kind of point A to B rather than A to C to B, TSRep.tv, I got my wisdom teeth. Just a couple more questions, all right? Got my wisdom teeth removed with deep sedation, and when I was under, I was talking and moving. How? So under deep sedation, you're lighter, right? Now, they gave you benzodiazepines, which causes anterograde amnesia, so you shouldn't remember anything, and you were probably very comfortable for the procedure. But it can happen where you're talking and moving minimally during that procedure, right? It's not general anesthesia where you go into the hospital setting in the OR and they put a breathing tube in, you have an anesthesia team to monitor. In office oral surgeries, generally we take out wisdom teeth under IV sedation. That's your deep sedation you're talking about. And yeah, it can happen where patients can get a little bit lighter, especially towards the end of the operation where it's not necessary to give more medication when the teeth are already out. You know what I mean? So it can happen. User 61013 just found out that TMJ was the cause of my ear issues. That can happen. That can happen. Yep. Luke Predental says, are there research publication requirements throughout your residency? There was for me, and I did get 1 or 2. I don't know if the second was submitted. I got to look into that. But yeah, we did 1. I missed the poster day at the dental school research day. I don't think they were going to give me off to be there anyway, but I missed it last week because the wedding I was at in Miami. Emma says, user 601, really? What did you experience with the ears? Eric Newen, what's up, Eric Newen? Are your co-residents planning to stay in New York area after residency? It looks like one of them's on the fence, whether going down to Miami or staying in the Manhattan, Brooklyn area. Another one looks like he signed in North Carolina, and then the other one signed, he's going to be working in Westchester. Yeah, so 2 out of 3 are staying in this area most likely. Yeah, Emma, I was feeling good after my wisdom tooth extraction. Wanted to go to the zoo. That sounds about right. Why the zoo? And then user 610 said, Emma, ear pain and doctor said ear infection prescribes so many antibiotics. Wisdom teeth leading to an ear infection. Very rare. Very rare. I don't know. Blank said, what watch do you have on today? Thanks for asking. This is the Filippo Loreti. It's a perpetual calendar with a moon phase. And as you can see, this moon phase, it looks like we're having a new moon right now. So no moon outside. You saw the eclipse today, hopefully safely and carefully. Thanks for asking. Adam said, what areas do... last question, guys. Last question. I got to head out. I got to eat dinner and get ready for tomorrow. We're at 19 minutes. I'm going to pop it at 20 because this will take a while to... post-produce and get out onto the platforms. What areas do OMFS leave for the ENT to do? I heard some areas OMFS don't touch. I'm not sure. It also depends on the program, Adam, because in certain programs like our program, we're doing all the facial fractures. We are. Other programs, and cancer, right? Other programs, they only do benign pathology. So they're not doing cancers, right? Because cancer is malignant pathology. So it's going to differ per program, right? Especially in the location, the area of the United States. So like in the Northeast, we don't want to toe the line. There's a lot of politics involved in the Northeast regarding scope and scope within each surgical service, and so that has a lot to do with it as well. Location throughout the United States. Frog said, "Thanks for answering. You got it, Frog." Emma said, "I don't know why the zoo. I just like animals." Me too, Emma. Did you get to go to the zoo since then? I hope it was 2 years, so I hope so. User 6103 said, "Yeah, but after going to ENT and having CT scan of the sinus and examination." Gotcha. Septoplasty for recurrent nosebleeds. Your thoughts? I would visit your ENT that sees you for some of those things, right? Septoplasty for recurrent nosebleeds. I'm going to leave that to them. I don't want to answer that question. I'm going to leave that to the ENT specialists. Everything was fine. She said it was muscle that was causing the pain. Yeah, okay. So you had some myofascial pain associated with it. That can happen. That's more commonly the issue with the TMJ and the pain that you're experiencing. Leo Samba said thank you. Underscore said, "What's for dinner?" I just my $6 microwavable meals, probably like chicken, kale, corn, like whatever they have. I get like these bowls. And I just eat whatever's in there. I can't afford much more than that, unfortunately. And then I have like cold cuts with hummus and wheat thins to kind of like an appetizer, if you will. Get some good hummus and protein in there. Emma, not afterwards. When I was told no, I cried. TS Rec TV, Meg joined. What's up, Meg? What's the best way to keep my wisdom teeth holes clean? I got stitches along with it. Great question. Hopefully they gave you syringes, one with the little spout on it to let you gently clean back there. But really just, you could swish your mouth out with water or salt water, salt mixed water. That could help if you do it gently. If you still have stitches, I would let them be. Don't pull out your stitches yet. They're going to fall out on your own. If it's in your mouth, it's most likely a 4030 chroma gut suture. That will come out usually between 7 to 10 days. Not medical advice, solely opinion. Got to throw that in there. And that would be. Luke said, any thyroidectomy in OMFS or more in ENT, all ENT. Thyroidectomies are generally all ENT. We don't do thyroidectomies with OMFS at our program. All right, friends, got to head out. Thank you so much for joining today. I will put in the top 3 viewers in the bio of podcast and YouTube. I'll be putting out a podcast on YouTube either tonight, tomorrow. It's starting to get late now, so we will see. Wishing everyone a great rest of the week. Thanks for coming on. I love you guys. You guys are my family. You know that. I really appreciate you coming on. We chatting. Hope you enjoyed. And again, I'm going to be posting this on YouTube channel and podcast. I'll be putting the top 3 viewers, top 3 listeners. Maybe you'll be in there. All right. When I close out of TikTok Live, it shows me who the top 3 are. All right, friends. Love you. Let's make it a great week.